We'll start at the beginning. The Alliance was founded on March 18, 1999 by more than 40 passionate volunteers.
These patients, survivors, and caregivers noticed a huge need for support in the CRC community, so they decided to be the difference.
After a few years, the Alliance developed into a paid staff of 10 who created our first helpline, buddy program, financial assistance program, and national conference.
These programs and more still continue today, with patients at the center of everything that we do. Learn more about our programs to advocate for prevention, magnify patient support, and accelerate research at colorectalcancer.org.
We've always liked to move, and exercise is good for not only prevention, but also survivorship. So in the early aughts, we started our own 5K, originally called the Undie 5000, and then it changed names to the Undie Walk Run.
But in 2019, we wanted to be clear about our goal, so we renamed it the Walk to End Colon Cancer. Now you can walk loud in 16 cities and growing.
In 2003, the Alliance created Scope It Out near headquarters in DC. Scope It Out is the largest community event against CRC.
This year's Scope It Out is on Sunday, March 24th, and coast-to-coast registration allows allies to participate from anywhere.
In 2006, stage 4 colorectal cancer survivor Anita Mitchell started Dress in Blue Day at her son's school. She partnered with the Alliance, and Dress in Blue Day went national.
In 2010, the Alliance was in trouble financially. A lot of nonprofits go through tough times, but a $6 million bequest by the late Carol Green let us continue our life savings work and fund assistance grants.
That same year, Michael Sapienza, his family, and friends started the Chris for Life Colon Cancer Foundation in honor and memory of his mother, Chris, who died from the disease at the age of 59.
In 2011, the Alliance established the Blue Hope Bash, the premier fundraising gala against colorectal cancer. It continues today and has expanded to several major cities thanks to our incredible volunteers and supporters.
In 2016, the Colon Cancer Alliance merged with Chris for Life, creating the nation's largest nonprofit dedicated to ending colorectal cancer.
1 year later, in 2017, the Colon Cancer Alliance changed its name to Colorectal Cancer Alliance to represent the whole community. Together, we are a nation of allies.
In 2019, the Alliance positioned its programs to screen, care, and cure to save 100,000 lives over 10 years, reach 750,000 patients and their families, and invest tens of millions in research.
In 2020, as the world faced COVID-19, we stood up the Care During COVID Fund to assist patients and caregivers during this crisis.
We also launched quiz.getscreened.org, our screening assessment and navigation tool that provides a screening recommendation based on a person's individual risk factors.
That's a lot of big words, but check out the screening quiz yourself and share it with the people who might need to get checked. That's quiz.getscreened.org.
In 2021, the recommended age to begin screening was reduced from 50 to 45 to reflect the changing face of this disease. Our collaborations and initiatives to highlight screening, including Cycles of Impact, Go to Know, 45 Plus Reasons, and the wide-reaching Lead from Behind awareness campaign, have tallied billions of impressions since.
The Alliance was busy in 2023 too. We launched BlueHQ.org, the Alliance's patient support hub. We secured a $5 million gift to seed our health equity efforts.
And we launched Project Cure CRC, with a goal of funding tens of millions of dollars in urgent research in 2024, in addition to the more than $5 million we have already invested through the years. This is a historical milestone, not just for the Alliance, but for the entire CRC community.
And that brings us to today, and the Alliance's 25th year of impact. It's an observance made possible by our nation of allies, including supporters, donors, partners, advocates, volunteers, advisors, board, and each and every single staff member, present and past.